Demand on your care. Medication management for older adults.
What if I miss a dose of medication? I forgot to take my medication this morning and suddenly remembered in the afternoon. Should I take it immediately?
Generally, if the time that you find you missed the dose is not too far from your original dose, you should take it immediately. However, if it is very close to the next dose, it's advisable not to take the missing dose to avoid consuming a large dosage in a short time, which could increase the risk of side effects. Here are some examples for your reference. Once daily medications. Take the missed dose as soon as you remember on the same day. Twice daily medications. If it is less than 6 hours since you forgot to take the medicine, you should take it immediately and take the next dose as scheduled. If it is more than 6 hours since you forgot to take your dose, skip the dose and take the next dose at the originally scheduled time. Multiple doses daily. Assuming that your medication times are 8 a.m., 12 p.m., and 4 p.m. Take the missed dose as soon as you remember, and adjust the timing of the remaining doses accordingly. For example, if you find out at 2 p.m. that you forgot to take your medicine at noon, take it as soon as possible and then take the next dose 4 hours later, at 6 p.m. Some medications are taken weekly. For example, some osteoporosis medications. You can take the missed dose in the next morning and continue taking the medication on the originally scheduled day in the next week. Do not take more than one dose on the same day. It's important to note that frequently forgetting to take medication is not a trivial matter and can have significant consequences. Firstly, it can delay treatment, allowing the condition to worsen. Additionally, missing doses of medications can lead to the development of drug resistance in bacteria or viruses, making treatment more challenging. Antibiotics and antiviral medications rely on being in the body for a specific amount of time to be effective. So missing doses can directly impact their effectiveness. Furthermore, for some chronic conditions, missing doses can pose serious health risks. For instance, anticoagulants are used by some patients with atrial fibrillation to reduce the risk of stroke. Skipping doses increases the risk of a stroke. Also, some asthma patients use inhaled steroids regularly to control inflammation of the airway and reduce the risk of asthma attacks. Not adhering to this type of medication can hinder the control of the disease and make it difficult for doctors to assess whether the current treatment is appropriate. Older adults and caregivers can make good use of medication organizers with alarms to remind them to take their medication on time, preventing treatment delays. If there are any doubts about whether the missing dose should be taken immediately, please consult healthcare professionals or pharmacists for advice.
Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.